Case 31. A 41-year-old woman who is a recent immigrant from Mexico presents to a local clinic complaining of white spots on her body. She says she first noticed the lesions about 1 month ago and thought they were from the sun, but they've gradually increased in number and have not improved despite her new job out indoors. Physical examination reveals multiple, asymmetrically distributed circular, hypopigmented lesions on the patient's arms, abdomen, and back. The lesions are sharply demarcated with raised erythematous borders and atrophic, scaly centers. The lesions are anesthetic, and there is no hair growth within any of the hypopigmented areas. Biopsy of the lesions demonstrates granuloma formation within the dermal nerves of the forearm. Biopsy of the lesions demonstrates granuloma formation within the dermal nerves of the forearm. Under what conditions does the causative microorganism grow? Both Lepromatosis and tuberculoid leprosy are caused by Mycobacterium leprae, an acid-fast bacillus that cannot be grown in vitro. M. leprae is an obligate intracellular bacillus that, like other mycobacteria, contains mycolic acid in its cell wall. M. leprae grows best in cooler temperatures, e.g. skin, peripheral nerves, testes, and upper respiratory tract. How does this patient's condition differ from a more severe form? This patient has tuberculoid leprosy, which is largely confined to the skin, hypopigmented macules, and peripheral nerves. Cell-mediated immunity is intact, and patient's T cells recognize M. leprae, positive Lepromatous skin test. Lepromatous leprosy holds a much worse prognosis because patients have ineffective cell-mediated immunity, negative Lepromin skin test. Skin lesions and nerve involvement are much more extensive than in the tuberculoid form, and there may be involvement of the testes, upper respiratory tract, and anterior chamber of the eye. What is the appropriate treatment of this condition? Both tuberculoid and lepromatous leprosy can be treated with a course of oral dapsone. The tuberculoid form is reliably cured by a short course of this medication. Patients with lepromatous leprosy have an exceptionally high bacterial load and may require an extended or even lifelong course of chemotherapy. Alternative therapies for leprosy include rifampin, or a combination of clofazimine and dapsone. What are the side effects of treatment? Dapsone can cause agranulocytosis, so patients should be monitored initially with weekly or biweekly complete blood cell counts. Rifampin can turn body fluids such as sweat, tears, and urine a red-orange color. Rifampin therefore can be remembered as the Gatorade drug, referring to commercials that showed athletes with colored sweat from drinking Gatorade. This can startle patients, and rightly so, if they are not counseled before commencing therapy.